Good afternoon, everyone, and a very big warm welcome. It's so wonderful to see so many of you here with us today. So this session has been organised to introduce and provide information about the University of Oxford's fully online postgraduate diploma in global health research. Just to quickly add, if there's anyone here who joined us last week, I just want to let you know that this is a repeat session, but you're more than welcome to listen in again if you choose to. My name is Kehkashan, and I'm delighted to be joined today by the Global Health Network's Director, Professor Trudie Lang, and the Acting Course Director for the online postgraduate diploma, Sinéad Whitty. And they will be both providing us a background for the course and an insight into how it will be taught and how it's been designed with the busy professional in mind. We also have with us Lauren Wellen, Acting Course Coordinator for the diploma, and Neve Simpson, Academic Programme Officer, and they'll be on hand to answer any questions as we run through the session. So before we begin, I'm just going to run through some basic housekeeping. Firstly, this session is being recorded, and the recording will be shared in the coming weeks on the Global Health Training Centre, so you can review and share with your friends and colleagues. You will also be sent a follow-up email to guide you where to find these. And due to the number of participants, your cameras and mics have been disabled. So to interact with the panel, please use the Q&A function or the chat function, and you can find these in your toolbar. If you have any technical issues, please do let us know in the chat, and the Global Health Network team will aim to assist you as soon as possible. We do encourage you to use the Q&A box. The panel will be answering any questions you post throughout the session. And there's also an option to ask a question anonymously if you wish to use this feature. In case we don't have time for all of your questions, we will save them and try to share written responses along with the recording, which will be shared in the coming weeks. Once again, for those of you who've just joined us, if you joined last week's session, I just want you to know that this is a repeat session, but you are more than welcome to listen in again if you wish to. So with all of that out of the way, we will now begin the programme. Firstly, I'd like to welcome Professor Trudie Lang, Director of the Global Health Network. Thanks, Trudie.
Thank you, everyone. Let me just get my slides up for you. Here we are. Wonderful to see so many people join the call. And I hope this is a really informative session, so you can learn about this diploma that we've set up. So I'm just going to start us off by explaining around the background to this in terms of the Global Health Network and why that was set up and how the diploma fits in to these overall plans. So what we're really trying to focus on is looking to support health research in every healthcare setting across the globe. And we want to do that by creating the abilities to run studies in every single sector of healthcare and build research capacity by doing that. And so, in fact, the diploma is exactly to give people the skills and abilities and connections also, so they can run a study themselves in any healthcare setting in which they work. So why is this necessary? Well, you know, I've been working in this field for more than 30 years, and sadly, it's still true that what's very well known as the 90-10 gap still persists. And that is that less than 10% of the research that happens across the globe is in the global south and resource-limited settings and benefits populations in those regions. And so most of the research that happens benefits the wealthy countries and diseases in the global north. And then even the research that is happening in low and middle income countries, many of the studies that are going on are actually led by remote researchers working somewhere else and are collecting data to go back elsewhere. And they're often not even designed locally or tackling the right priorities locally. And that's because lots of the old approaches to building research capacity really focused on one disease or one product, and that left no lasting capacity really for local research leadership. And so whilst we've made huge strides over the past 20 years or so on really doing some excellent work, you know, the progress we've made with things like the malaria vaccine or understanding about antimicrobial resistance or all the big areas that people have tackled. And obviously we saw how this came together with outbreaks like Ebola and Zika. We are still really stuck with not enough locally led research teams who are able to be competitive, win significant grants and run their own teams. And so that is what really the Global Health Network is all around. It's trying to create equity in access to knowledge and information and training so that a researcher in Nepal or Colombia or Bhutan, Ethiopia can access exactly the same quality of training tools and support as a researcher anywhere in the world. And this is exactly what we're trying to achieve with the diploma. And so just to be really clear about what this means, we've done a lot of research on this as well, and worked with hundreds of thousands of researchers over the years. It really doesn't matter what type of study you're working on or the disease that you're working in. Research needs to happen in an ecosystem. And what we mean by that is for any disease that is trying to be addressed, you need a whole raft of studies. We have a lot of focus on clinical trials, which is great, but clinical trials don't happen in isolation. And to understand any disease, you need to first of all do surveillance to know what the burden is and how much of a priority it is in the region. You need to do disease characterization studies to describe that disease. We then need to understand what the possible interventions could be, and then of course clinical trials to test them. Really important throughout all of this is community engagement and social science to understand the context. Of course, we've got laboratory work alongside that to even do diagnostics and then look at maybe some safety of the interventions, genomics, tracking mutations and pathogens, how they change over time, and looking for those variants of concern, which we've obviously learned so much about with COVID, but it's true for AMR or evading drugs for malaria. And of course, we need to do things like health economic modelling and doing all those pieces that happen around the looking at the disease, so we can really spot where disease burdens are, understand how to address them, and then prevent future impact. And any one of these studies has the same component steps in terms of setting the question, turning that question into a protocol, planning and operating a safe piece of research, analysing the data, working with the community to make sure your research is appropriate and tackling the right questions and the right people, and making sure that your findings and evidence doesn't stop at a paper, but taken up into policy and practice. And so we talk about this a lot, and we've seen it obviously play out with COVID and other outbreaks such as Ebola or Zika. But this is true for diseases that have been with us for as long as mankind, like malaria or diarrheal disease. And so what we're really aiming to do with the diploma is teach all the steps within these component whole ecosystem, and also within the steps required to deliver a good study. So on that note, I'm gonna stop giving you that overview and just explain how this sits in the context of the whole community of practice that we have with the Global Health Network. And I really hope some of you are interested enough to apply and hopefully join us on this exciting diploma course. So thank you very much, Kehkashan, and I'll hand back to you.
Thank you so much, Trudie. So I'm sure by now you'd like to know more about the course structure and how the fully online diploma will be taught. So I would like to welcome Sinéad Whitty, the Acting Course Director for the Postgraduate Diploma in Global Health Resource.
Thank you very much, Kehkashan. Hello, everybody. It's lovely to see so many of you here today. Thank you so much for your time. I'll just open up my slides now and share the screen. So thank you very much, Kehkashan and Professor Lang, for such a wonderful introduction and giving the overall context for where the postgraduate diploma in global health research sits and fits, and what our overall objectives are with the programme. Today, we're going to go through the following agenda and give you an overview of the structure of the course itself and what you could expect as a student on it, and what we expect of you, what you can expect of us in terms of support and so on. And we'll give you all the key details and more as we go through. Please be sure to put your questions into the Q&A box as we go along, and we'll answer those as we're going through, and we'll also have time then at the end for your questions as well. So I'm delighted to introduce the new course to you, and I think we should really begin with where it sits, and the University of Oxford itself. Teaching has been taking place here since 1096, and for the 7th consecutive year, the University of Oxford has been ranked #1 in the world by the Times Higher Education World University Rankings. It's the only university to have received that award 7 years in a row. Many of you are joining us from abroad, and you'll be glad to know that we're well used to welcoming international students. The first was Emo of Friesland, and he arrived here in 1190. Women students are also incredibly welcome at the University of Oxford, with the first women beginning their studies in 1878, and it was in 1920 that women were awarded full membership of the university, which meant that they could then be awarded degrees. And in 2020, the then Vice-Chancellor, Professor Dame Louise Richardson, reflected on 100 years of Oxford degrees for women. And this is what she said. What books might have been written, what discoveries made, what musical scores or poems written, had women had access to the same education as men. But now women are here and are here in force, and that's something to be celebrated. And we absolutely concur with those sentiments and strongly encourage applications from women for this programme. And having been at the forefront of global efforts to combat COVID-19, the university also celebrated the development of the Oxford AstraZeneca COVID-19 vaccine. And by early 2022, more than 2.6 billion doses of the vaccine had been supplied to over 180 countries, 2/3 of which were in LMICs. The vaccine itself is estimated to have prevented over 50 million cases of COVID, 5 million hospitalizations, and saved 1 million lives. So I hope this gives you some indication of how unique the University of Oxford is. And I'd like to outline now the uniqueness of the course itself. So this postgraduate diploma in global health research is the first award-bearing course designed to be fully online at the University of Oxford. So since 1096, this is an absolute first. It's also unique in that there's no requirement for you to travel to Oxford at any point. So you don't need to worry about visas, the cost of travel and accommodation and living expenses in the UK. You don't need to leave your family or uproot them. You can stay in your work. And importantly, you can immediately apply the benefits of your University of Oxford education in your workplace and for your local community. We've worked very hard to design the course for busy professionals. And there's as much flexibility built in as possible to enable you to combine the online study very successfully with your already busy week of work and personal commitments. And we've been careful to ensure that you will be able to fully enjoy the Oxford experience online. And when people talk about the Oxford experience, what they mean is that very supportive, collegial atmosphere with access to world-class experts and world-leading resources all at your fingertips. The content of this course, we believe, also is unique. We begin by asking, what is health research? And we progress very logically through all those points that Professor Lang just described. And we finish up with studying how to convert research into practice, because of course we're all about implementing the findings that you come up with. So the Postgraduate Diploma in Global Health Research is a part-time course offered by the University of Oxford. It's taught in English and delivered fully online over 4 terms. So that takes 14 months. We begin in October of 2023, and will finish the following December. And the course is designed for all those involved in the funding, design, delivery or regulation of research in global health. And this includes medical doctors, research nurses, study coordinators, community engagement professionals, statisticians, pharmacists, those working in data collection through to data management, and many, many others. And taking this course will give you a thorough understanding of the steps and processes required to conduct high quality, ethically framed studies, especially in the context of resource limited settings. And I want to spend some time to look at how the curriculum has been created, because it was a very, very special and again, quite a unique process. In collaboration with TDR, colleagues here at the Global Health Network recently carried out a large-scale gap analysis and Delphi study with workshops attached to it to identify the key subjects required in global health research. Excuse me. And as you can see there on the left, over 7,000 people participated in this research. And these were researchers, predominantly from LMICs, and also stakeholders, including representatives from organizations such as the European Commission, the World Health Organization, the Bill and Melinda Gates Foundation, and the European and Developing Countries Clinical Trials Partnership, EDCTP. So this is absolutely a crowdsourced, need-led curriculum designed by the research community for the research community. So we have taken the findings of this Delphi study to come up with key modules that should be included in the programme. And then we also mapped the curriculum against TDR and TGHN's competency framework. You can see that outlined on the right-hand side. And the competency framework lists all the skills and competencies required for a well-functioning research team. So by putting the two of those together, we have come up with the curriculum for the diploma. Now, from all the research that I just outlined to you, the key subjects emerged very clearly, and they naturally fell into 4 key areas, which gave us the 4 terms that we teach, and also the 4 course learning outcomes that you can see on screen. And I'm sure for all of you in attendance, you will see that these are very, very related to your work, to what's important to you and your team, and to what's important to ensuring that the research you carry out, excuse me, is of the highest standard. Excuse me. So how do we ensure that we help you to gain these key skills and competencies that make up the course learning outcomes? Well, the first step is in the content that we teach. And as you can see there, Term 1 focuses on research design, Term 2 on data management and analysis, Term 3 on quality systems, and Term 4 on research implementation. Now, for each term, you study 4 subjects. So you take 2 for the first half of the term and 2 for the second half. So each week you'll study 2 lessons. A lesson runs from Monday to Friday. And we'll take a look now at the structure of a typical week so you can see what you might want to expect. So each lesson follows the same structure. So once you learn your way through it, once that's it, you'll know exactly what to do for every subsequent lesson. We begin with a pre-recorded lecture. That's interactive, so you can add questions and comments to it, and your teachers and classmates can reply on there as well. We follow that with some real-world tasks. These are recorded onto class-wide discussion forums, so you can again interact with your classmates and with faculty here, And you can learn from each other as well. You can see the different approaches that people would have to the same question. So you get what's called formative feedback on those discussion forums. And that means you don't get a grade or a percentage, but rather you get feedback that tells you what you're doing correctly and what you need to do to improve. So you might give your answer and the faculty might ask for you or for others in the class to maybe build on what you've said. So that's one example of formative feedback there. Then midweek, we come together for a live class, like we're here today on Zoom. And this gives you an opportunity to interact in real time with your classmates and with your teachers, and also have your questions answered straight away. Now, because we've already studied the lecture, the live class is not a lecture. This is where you come to spend time teasing out the parts of that week's topic that are a bit difficult, a bit challenging, or maybe that you have specific questions related to your work. So for example, if we're talking about informed consent, and maybe you work with vulnerable populations and you're wondering about what's the correct way to proceed if you're doing a pediatric study and you're looking for parental consent, and what happens if the parent is actually a child under 18. Can they give consent for their own child to participate in the study? So it's real life questions like that, and this should keep it really, really interesting and meaningful, and again help you learn not only from the content that we're teaching and the world's leading professors who will be teaching you, but also from your peers within the class, so that you can share your real life experiences. Finally, then, every week you're asked to write up a short guided reflection where you really outline what you learned that week that was important to you, why it matters to you, and how you're going to apply that to your work. And it's that how you're going to apply it to your work that's really, really critical, because that's where you need to think, okay, who will I need to support me on this? Maybe I'll need to train up some of my team. Maybe I'll need to talk to people in the wider workplace or external stakeholders. And what challenges am I likely to face, and how am I going to overcome them, so that you have a plan in mind as to exactly how you're going to apply what you're learning. And to help you with that, every single student has their own personal tutor. So you will have one-to-one tutoring and mentoring every week in your guided reflections. And that is a private space just between you and your tutor. So you can have very, very candid and open conversations there. The guided reflections we'll mention again when we talk about assessment, and also those real world tasks. They'll come up again when we talk about assessment. So I'll talk about that in another minute. But what you can expect in how will all that look when you come in to your online class. Let's take a look at that. Excuse me. We use the University of Oxford's online platform that all Oxford University courses use. It's called Canvas. If you're familiar with other online courses, all these platforms are pretty similar and they're quite easy to learn and user-friendly. So what will happen is you'll log in to Canvas, and there you'll find your class with everything you need right there on one page for you. So you'll start at the top of the page and you'll work your way down, and therefore you can't get lost, you can't miss anything important. The recorded lecture is going to be here, the links to the discussion forums, the tasks that you're asked to do, everything will be there for you. And you should allow about 20 hours a week if you're studying 2 lessons that are completely new to you. Now, because all of you will have a relevant educational background, and most of you will also have significant relevant work experience, there's probably very little content that's going to be brand new to you. So you might not need a full 20 hours every week, but it's a good ballpark figure to keep in mind. because there might be times that you need to spend more time preparing for assessment, for example, or really studying in depth with something that's very new. And then there'll be a week where the topic is very familiar to you. So you'll need less time there, and overall it'll balance out. Now, what else about Canvas? Yes, just important to say that Canvas and all the other technology we use in the course is available as a free app. So that's going to be really useful for you to use on the go, and maybe to have that on your phone if you wish. Also, as much as possible, all the content will be available for you to download so that you can work offline if you need to. Now, interaction is really important in this course. So we would ask that you, log in every day and engage with your classmates and follow how discussions are evolving and so on. But you can certainly minimize the amount of time that you need to be physically online. So everything that you need to successfully complete the course is provided for you here on Canvas. That includes your reading list and additional resources. So they might be books, chapters, journal articles, videos, podcasts, anything at all that you need will be there. But you will also have full access to the University of Oxford's libraries. Now, these are not only stunningly beautiful, but they hold a wealth of treasures for you. So on the right of the screen here, we have the ancient and really beautiful Bodleian Library, and to the left, its next door neighbour, the Radcliffe Camera. And these are just two of the 100 libraries that make up the University of Oxford's Bodleian Libraries group. The Bodleian is a library of legal deposit and has been for over 400 years. That means it gets a copy of everything that's printed in the United Kingdom. And so as a student on this course, you will have access to the more than 1.4 million ebooks, 118,000 e-journals, and 1,300 databases at your fingertips. Now, I'm in no doubt that having such easy access to world-leading resources will help you succeed in your studies, in your workplace, and also in your assessment. So assessment, again, is designed for busy professionals. We have one assessment per term. How it works is a term lasts 10 weeks. We teach for the first 9 weeks, and week 10 is assessment week, when you present as a group project that will be a response to a case study, a real world scenario, and you will make a 10 to 15 minute presentation, and there will be a Q&A session afterwards with the examiners. And the other part of your assessment is an individual reflective essay on what you've learned, why it's important to you, and how you're going to apply that in your workplace. So if you remember those weekly reflective essays that we talked about, what you can do is basically bundle those together and submit that as your reflective essay. You also add some detail about what you contributed to the group project and what you've learned from that. Now, that team project is really, really important. We give you a lot of support for that as well. So what happens is the first week of term, we publish the assessment details and we form you into teams of about 5 people. And we have a tutor for each assessment team. So the tutor's job is to help you establish as a team and decide how best you're going to communicate together. You will have a private working space on Canvas where you can keep all your documents, you can have your conversations there. But a lot of teams also like to use WhatsApp or something like that as a really quick and easy means of communication. So that's entirely up to you as a team to decide how you're going to work together, but with the support of your tutor. So in the 4th week of term, what happens is you as a team will submit the first draft of part of your assessment, and you'll get feedback on that, which again will tell you what you're doing well and what you need to do to improve. So you should have a roadmap to success based on that draft that you submit in week 4. And this helps you to prepare for the real assessment, which is in week 10. So that's the plan. And as you can see, there's a lot of support built in there. And also in the course design, all the tasks that you're asked to do every week and everything that we teach you is in support of your successful completion of this assessment. So everything's connected, the teaching, the tasks and the assessment. So there's no one crunch point where you might say, oh my goodness, I need to take time off work in order to get this assessment done. That's not what we're about at all. It's fitting it in gradually every week and then coming together for these presentations to really celebrate the learning and the outcomes of your 9 weeks of hard work. So that's how we see assessment, really, as a celebration of learning. And again, you get to share what you've learned and also learn from your classmates. Yeah, I'll say more about assessment another time. But in addition to the theory and practice, you should gain an understanding of the transferable skills that you're developing as you work through the course. There's a long list of them there on screen. You know, critical thinking and problem solving are key. Intercultural communication, interpersonal skills, advocacy, influencing, clear communication of your scientific findings. These are hugely valuable and really directly related to your workplace. And we hope that these skills will directly benefit your work and your future research. So support for students is a key part of the world's leading teaching that you can expect to benefit from at the University of Oxford. And as an Oxford student, you will be supported by the academic and administration teams. That's with the formative feedback that you receive every week as a class and as an individual. By your individual tutor and your assessment team tutors. You'll also receive ongoing weekly support, but also hugely important is the peer networks that you will develop. So those informal connections with people who are working in research just like you, who understand the challenges as well as the opportunities of working in low resource settings, and maybe working with very vulnerable populations. So although the reality might be like the picture on the top of the screen there, that you will be sitting on your own on your computer early in the morning or late at evening and you're working away on your coursework, it should actually feel like the image on the bottom of the slide, that you're part of this very supportive and friendly and helpful peer network, that you can support each other. You'll have a small group that you can pop a WhatsApp message to, and you'll keep each other going those weeks when you're a little bit stressed or short for time and things are a bit challenging. Those peer networks become really vital to helping you succeed in the course, but also these peer networks are just such a joy to have in our professional lives. So hopefully there will be at least a small number of people that you'll meet on the course that you'll decide to keep in touch with long into the future. So I hope at this stage you're as excited as we are about this course and you've decided this is the programme for you and you'd like to apply. So our entry requirements are as flexible as possible. If you have a degree, we are looking for a degree in any of the following: public health, global health, basic science degree, or an allied health professions degree. If you don't have a degree or your degree is in a different field, what we're looking for then is 3 years relevant work experience that's broadly equivalent to a strong degree. And if you're in any doubt as to whether you meet those entry requirements, do please send us an email. Lauren and Neve, you might pop into the chat the PGDIP email address there, please. So how to apply? The link there for our applications page is on screen. We'll also put that into the chat, and we'll put this up as well at the end. There is an application fee for any course at the University of Oxford. That fee is set at £75. There are waivers available. So if you're from a low-income country, there is a fee waiver. Again, if you're unsure if you're eligible for a waiver, please get in touch with us. You need to submit some supporting documentation with your application. So I would encourage you to begin the application process now. You can do part of it and then come back and fill in another piece, and then come back again and fill in another piece again. You will need 3 references, and sometimes it can take time to contact your referees and for them to write the reference and submit it for you. You'll also need official transcripts if you're using your degree as your admissions as evidence of meeting the entry requirements. And again, it can take time for your university to supply you with the official transcript. So do please leave plenty of time for that. Our next application date is the 1st of March. So we're into February now, so it's a good time to begin the application process, and then you have plenty of time to do it. What happens is we shortlist candidates, and that's based on the application criteria, and we interview shortlisted candidates. So for people who applied in December, we're interviewing shortlisted candidates at the moment. For people who apply by the 1st of March, the interviews will be mid to the end of March. There is a course fee, and that is currently set at £12,880. I appreciate that is a lot of money. Bursaries are available, and again, this is another unique element to the course. We want this course to be as accessible as possible for as many people as possible. So we have bursaries available for up to 30% of the students on the course, which means that up to 30% of students will have their fees fully paid for. So please don't let money stop you applying for the course. You never know. We've had the most fantastic, strong candidates apply so far. And, you know, bear in mind the bursaries are there. So do please talk to us about those, talk to us about the application fee waiver, and send in your application, because you never know, maybe you'll be one of the people who is awarded a bursary, and then all your fees are paid for. The University of Oxford also requires students to have English language proficiency. For some people, this means you need proof of having taken a relevant English language test and attained a certain level in it. There are waivers for that as well. So contact us if you're unsure if you qualify for a waiver for the English language requirement. If you receive a bursary and you need to take an English language test, the bursary will also cover the cost of the test. So again, don't worry about it. Send in your application and we can talk to you then about the next steps as and when that is required. So for those of you who joined us after the start, just a reminder that this has been absolutely a community-led curriculum designed by the research community for the research community, with over 7,000 researchers and key stakeholders, predominantly from LMICs, contributing to the course design. And you know, we've talked a lot today about how special the University of Oxford is and how special this course is. And we really believe that to be true. But really what makes the University of Oxford special is the people. And as you can see here, there's such a wide range of leading people in their fields who are connected to Oxford. On screen here, we have a list of Oxford people, past and present. And we'd like, you know, there are so many more names we could add here. We could be here all day, but really we'd like to add your name. So will you join us? So do please apply for the course. Talk to us if you have any questions. And the email address is on the screen now. I'll stop sharing and we'll take a look at the Q&A.
Thank you, Sinead. That was wonderful. We had a nice steady flow of questions whilst you were presenting there. So many of you may have noticed Lauren and Neve answering all your questions during the session. Just for your information, they will both be the ones you'll be in contact with for support when you're enrolled for the course. So Neve and Lauren, if you'd like to quickly introduce yourselves and say hello.
Hi everyone, I'm Lauren. I'm the acting course coordinator for the programme, and it's great to see so many of you here with us today.
Hello, hi, I'm Neve and I'm the programme officer for the Postgraduate Diploma. Glad to see everyone here.
So Lauren, maybe you can help me. I see you and Neve have been very busy answering most of the questions as they've come through. Thank you so much for that.
Yeah, we have lots of questions and lots of interaction. So if anyone wants to ask any more questions, please use the Q&A feature. Sinead, I have pulled out a few for you. So I will start with, could you please explain the difference between global health and public health?
Yeah, global health is public health. And what we do when we talk about global health is we focus on diseases of poverty or diseases that predominantly affect people in LMICs. And that might be geographically, just a geographical fact of nature, such as malaria, for example. So it's public health in LMICs typically, and focusing on diseases of poverty as well.
Thanks, Sinead, that's great. We've had lots of questions about people asking about course fees and funding opportunities from people based in low and middle income countries. So just for anybody that may have not joined from the start, would you mind just going back over that, please?
Certainly, and thanks everybody for those questions. They're hugely relevant. So the course fee is £12,880. Because we want as many people as possible from as many countries as possible to be able to participate, we have a system of bursaries, and up to 1/3 of students on the course may be awarded a full bursary. That means that your course fees will be paid in full. And I think that's a really important feature. So if this course interests you, please don't let that course fee stop you from applying. You should apply because you never know, you might receive the bursary. We have set criteria. It's a points-based system on which the bursaries are awarded. If you're from a low-income country, you get more points than somebody from a middle-income country, and somebody from a middle-income country gets more points than somebody from a high-income country. And there are other criteria there too. So get in touch with us about that, but everybody who applies is automatically considered for a bursary. You don't need to fill in any additional paperwork. We'll just consider everybody. So that's a really important step. Also, there is an application fee for the course, and that is standard across the University of Oxford. The application fee is £75 sterling. And I realise as well that that is a significant investment. There are application fee waivers for some people. So if you're from a low income country, there are application fee waivers available. If you're unsure whether you meet the criteria for an application fee waiver, or if you're having difficulty finding the money to apply, please get in touch with us and let us know, and we can certainly clarify for you whether you would meet the criteria for an application fee waiver as well.
Thanks, Sinead, that's great. And just some more information on the course. Are the lectures going to be pre-recorded, or will they be live sessions each week?
So the lectures are pre-recorded, which means that you have plenty of time. You can study that lecture any time of the day or evening that suits you. You can pause it, rewind, download it. You can hold on to the slide deck that accompanies it and make your notes on that. And then later in the week, we have a live class. It's not a lecture because we've already had the lecture. But the live class is designed for really robust discussion, for spending time on the most important aspects of the lecture, for spending time on the most challenging parts of the lecture, to make sure that by the end of the live class, all your questions have been answered and you really have a solid understanding of that week's lesson.
Thank you. And once completing this course, will it count towards applying for a master's or a PhD programme?
That's a great question. So the postgraduate diploma is taught at the same level as a master's programme. The difference is a master's programme would also include a thesis or a research project. So we don't have a thesis or a research project, but other than that, the standard of teaching is the exact same as a master's. So what happens is when you apply for a master's or a PhD programme, in your application, you would include your transcripts from the postgraduate diploma, and then the course team running the master's or the PhD would see, okay, we teach, say, statistics. You've already studied statistics and you've passed it. So they might say, you don't need to take the statistics element of our master's course. So you might have a slightly shorter number of subjects to study on the master's program that you choose. It will vary depending on, what you choose to do after the postgraduate diploma, but we can certainly support you in that and talk to the course committee of the courses that you have in mind afterwards. There is I'm losing the power of speech now. There is a system of university credits, and in the United Kingdom, 1 university credit is 10 hours study. So when academic teams talk to each other, they talk about how many credits was the module on statistics worth. So that way they know, okay, that's the same as we teach, or it's more than we teach, or whatever it is. So there's very good interoperability between educational qualifications. So I can't be more specific than that, I'm afraid, because it will depend on what course you want to study. What I would say is your postgraduate diploma will be absolutely recognised by everybody. It's from the University of Oxford, the #1 university in the world. Talk to us if you have a particular master's programme or PhD programme in mind, and we can take a look at that and see where the overlaps might be and talk to the relevant team with you.
That's great, Sinead. I think, yeah, that's a wider conversation and we could sit here for a very long time discussing it. So I had a few questions about if there's an age restriction or who you think would be the ideal student whether they're in the middle of their career, the start of their career. So
yeah, that's fantastic. First of all, no age restriction whatsoever. Everybody is welcome. And, you know, if you look around your workplace, you'll see that we have really experienced people with more than 20 years work experience. And they're phenomenal people to have on the team or to be able to talk to about particular things. And we also have new people right at the start of their career, full of optimism and enthusiasm and energy, asking lots of questions, bringing new ideas. And that's really, really refreshing and really important. So that's what we want in our course, and everybody in between. So as you will have heard right at the start, you know, we listed out such a wide range of professional backgrounds that we would love to see on the course. We would love to see a range of ages represented on the course as well, because that reflects real life, and there's an awful lot to be learned by all of us talking, whether we're early, mid or established career levels. You're at a distinct advantage this year because this course is brand new. We're writing it as we speak exactly for you. So we're looking at the applicants, what career stage are you at? And that's where we're pitching our course content to. What was the other part of the question, Lauren? Sorry, apart from age restrictions.
What part of your career you're at, early or middle?
Yeah, we would ideally love if there's a good mix there as well, because the questions that people ask when they're earlier in their career, you know, those very fundamental questions, they're really important. Sometimes, you know, even people who are quite well established in their career, they might have a couple of things at the back of their mind that they're not fully sure of, but they've been doing the job for so long that they really can't they feel like they can't ask anybody in work because they're supposed to know it. But this course gives you safe spaces to ask those questions in private to your personal tutor, but also when there's, you know, somebody earlier in their career and they ask the question and you don't have to, that's a real benefit too.
Yeah. So we have another question, Sinead, which is about the libraries and how long will they have access to the Oxford libraries?
So you
as a student, I mean.
Yes, as a student, you have access the whole way through your course. So even when we have holidays, and you'll have at least 2 weeks break in between the terms, longer in what's called the long vacation, that would be the summertime in the global north, which would be, you know, June, July, August, you still have access to the libraries, and you can go in, you can read material, you can download it. If you're looking for something in particular and it's a book on a shelf in the library, you can request the librarians to digitize it for you. And the University of Oxford libraries are just phenomenal. They really are a treasure.
That may lead you on for the
yes. Yeah, we have a gift for all of you today to thank you so much for your time. It's a virtual tour of the stunningly beautiful Bodleian Library. So Kehkashan, you might pop that link into the chat there, please, if you have it to hand. So you can all enjoy that and see what's ahead of you as a University of Oxford student.
Yeah, and we've had lots of people asking in the session if the session is being recorded and if the presentations can be shared. So just to let everyone know, the session is being recorded and it will be available on the Global Health Training Centre. Danny or Kehkashan, can you pop a link in the chat, please? It'll be in the next couple of weeks because we have another information session next Thursday as well. You don't need to attend because you've attended today, but you're more than welcome to attend if you want to.
Yeah, and what I would say as we finish up is to please be sure to email us if you have any questions after this, or You know, if you have colleagues who couldn't be here today and they have some questions, they're very welcome to get in touch. And do please apply. You have absolutely nothing to lose and everything to gain. We would love to have you with us in October. So thank you so much, everybody. Really appreciate you being so generous with your time today. And we look out for all of you for the 1st of March application deadline. So do apply and come and join us from the comfort of your own home. We hope to see you all in October. Thank you. Bye-bye.